Good evening, I'm Olivia Quay. Singapore has been seeing a rise in the number of confirmed Omicron cases over the past week, but the local COVID-19 situation remains within control. At a press conference today, the COVID-19 task force shared new details. 1,281 confirmed Omicron cases were detected over the past week, of which 233 were local infections and the rest were imported. The task force also announcing that it's putting in place appropriate response measures to prepare for an imminent Omicron wave.
Every week, we administer over 150,000 PCR tests, and that works out to over 21,000 PCR tests per day. Positive rates for these tests are under 2%. We also have 155 wastewater testing stations across the island. They are in housing estates, dormitories, nursing homes, etc. Only a very small handful are registering the presence of COVID-19 viral fragments. So we are sure that the incidence of COVID-19 in our community is currently low and stable. But Omicron is already in our community. While community cases are not high currently, Omicron accounts for close to 20% of local cases, and it is a matter of time before it starts to multiply quickly, and we must be prepared for that.
The task force is studying what's happening around the world as well as Omicron continues to spread. Director of Medical Services, Associate Professor Kenneth Mark, explains what an Omicron wave could look like once it hits Singapore.
We will watch the situation closely to see if the increase in case numbers reported over the last 2 days reflects the start of such a wave in Singapore. Minister has shared our concern that the next wave may be bigger than the Delta wave we had dealt with in October and November. At its peak, we saw case numbers reaching about 5,000 in one day. But the number associated with an Omicron wave may far exceed this, perhaps even 10 or even 15,000 in a worse case scenario.
With an Omicron wave likely to hit in the coming days and weeks, and with Chinese New Year just around the corner, the task force says it's not in any hurry to relax COVID-19 restrictions.
We are keeping to the present posture. Group size remains at 5, certainly through this wave. When will the wave pass? No one knows, but I can't imagine the wave passing before Chinese New Year. So very clearly, through this period and through Chinese New Year, the current rules will be maintained. Chinese New Year may be a time when Omicron cases are rising, so we cannot afford to have more super spreader events taking place during that time. And therefore, we would like to encourage and urge everyone to continue exercising personal and social responsibility and to comply and cooperate with all the safe management measures. Let's all do our part to keep our family members, our friends, and our loved ones safe, even as we usher in the new year.
In an effort to combat waning protection against new variants and to encourage the public to get their boosters promptly, from February the 14th, boosters will be required for people 18 and above to maintain a fully vaccinated status, which affects access to vaccination-differentiated venues like malls and restaurants. The validity of the vaccinated status will expire 9 months or 270 days after the second dose of an mRNA vaccine or the third dose of the Sinovac or Sinopharm shot. Those who haven't reached the 9-month expiry period by February 14th will still be considered fully vaccinated. Minister Ong further explains.
From now to 13 February 2022, as long as you have taken 2 doses of mRNA or 3 doses of Sinovac Sinopharm vaccine, regardless of how long ago you have received those jabs, you will still be deemed as fully vaccinated. Then, on 14 February 2022, if your last vaccine dose was taken before 20th May 2021, that is 270 days or 9 months ago, your full vaccination status will lapse. So to maintain your full vaccination status, you will need to take a booster vaccine dose before the deadline of 14 February 2022. So we are setting the effective date quite a while from now, 1.5 months, 1.5 months from now, so that everyone whose vaccination status may lapse on the deadline of 14 Feb 2022 has a chance to get their booster jabs early and before the deadline. Those who have not reached the 9th month expiry or who are medically ineligible for boosters, you will not be affected.
And based on evidence that Omicron, while more transmissible, is less severe, from tomorrow, healthcare protocols will be further streamlined, with primary care doctors or GPs playing a bigger role in deciding whether a COVID-19 patient can recover at home or if they need closer supervision. Here's Mr. Ong again on the revision to the protocols for low-risk patients with mild symptoms.
Under the new arrangement, individuals who see a primary care doctor will be clinically assessed based on their symptoms and health status. For low-risk individuals with mild symptoms, the primary care doctor will be able to make an immediate diagnosis and administer an ART on the patient. If ART is positive, a medical cert will be issued and the patient will be asked to isolate himself for next 72 hours. After that, if he tests negative on a self-administered ART, they may exit self-isolation and resume normal activities. But if at any point in time they feel unwell, their primary care doctor will be there to support them. If any point in time they feel really unwell, they can always seek medical attention from our hospitals, including calling 995.
Visit straitstimes.com for more on today's announcements. You can also watch the full media conference on the Straits Times' YouTube channel. Subscribe by hitting the button below. I'm Olivia Quay. See you soon and take care.